So good morning. Yesterday, the Department of Public Health reported 786 new COVID-19 cases out of a little over 61,000 tests. At this point, over 21.5 million tests have been recorded here in the Commonwealth. 525 individuals are in the hospital with COVID, and 143 are in the ICU. In December, we set a goal of vaccinating approximately 4 people in Massachusetts. According to the CDC's data, 3.95 million people have been fully or partially vaccinated in Massachusetts, and there's another 180,000 people who are signed up to get their first dose in the next 7 days. Since about 99% of the people who get their first dose in Massachusetts return for a second dose, that means the 4.1 million people vaccinated goal that we set as our target will be fully vaccinated by the beginning of June. This represents an incredible achievement. The people of Massachusetts are outperforming the rest of the country by leaps and bounds. As a result, hospitalizations are down by 77% since January 1st. New positive cases are down by 82% since January 1st. And the most vulnerable residents of Massachusetts are protected from this terrible virus. But with that said, we know there's still a lot of work left to be done to vaccinate more people in Massachusetts, even as supply is now available. Now that we believe we are going to hit the 4.1 million goal we started with over the course of the next few weeks, it's time to adapt our vaccination effort to make sure we get to some of the harder to reach populations. Let me start just by saying that today there are open appointments for vaccines in every part of the state. This includes mass vaccination sites, retail pharmacies, community health centers, and regional collaboratives. This is obviously a welcome change from a few months ago when demand was exceedingly high and supply was not. If you're someone who's waiting to book your appointment when it's easier to schedule one, this would be a really good time to sign up and get your shot. You can go to vaxfinder.mass.gov to find availability in your area. Our administration set out to first vaccinate our most vulnerable populations, including healthcare workers and seniors, and we've seen great success in reaching those populations. Secretary Sutters will talk more on that in a minute. At this point, we're adjusting our vaccine distribution strategy to be more targeted, and we'll shift vaccines to smaller scale operations that can focus on particular communities or particular populations. And by bringing the vaccine to where people are so that everyone knows they have an easy opportunity to protect themselves and their families, we hope to make this process more convenient, more accessible, and continue to add to the count of those who are already fully vaccinated here in Massachusetts. We'll begin this shift in part by providing 22 regional collaboratives with more doses to run their programs, doubling the state vaccine allocation for our 20 most disproportionately impacted communities, and expanding our mobile vaccination clinics. Over 21,000 doses have been administered through mobile vaccination efforts through a combination of our equity work, our healthcare providers, and our mass vac sites. They've been deployed in Boston, Chelsea, Brockton, Fall River, Springfield, and New Bedford, and will continue to expand. The mobile clinics have been particularly effective in our equity communities and to reach people of color. So far, over 60% of vaccine recipients at these clinics have been people of color. We'll continue to expand these efforts statewide to bring vaccines to senior centers, houses of worship, YMCAs, and other community-based organizations. Every community and every region is different, so our administration will look to providers and municipalities as they establish creative ways to meet their community's needs. There are already some great examples of this. The Metro North Regional Collaborative will start operating 3 new clinics, including one at the Encore Casino in Everett, the Tufts campus in Medford, and at the Cambridge Health Alliance location in Somerville. Boston Medical Center, which has already done a large number of partnerships with community-based organizations, faith-based organizations, and is also operating a variety of pop-up sites at grocery store parking lots and other locations that are heavily traveled. We'll schedule appointments for individuals at the South Bay Shopping Center. Lynn, New Bedford, Worcester, and Fall River are offering more mobile clinics at local churches and temples in different languages. And the City of Brockton is holding several clinics at municipal housing and the Westgate Mall. We know physicians are also one of the most trusted sources to administer the vaccine, and that's why our administration has invested in public messaging campaigns that feature doctors and other hospital and healthcare employees as they share all the reasons why these vaccines are tested, safe, and effective. It's also why we work with our hospital, healthcare organizations, and other medical partners to enable patients to get their shots from a doctor. As part of this new phase, the Command Center is talking to the Mass Medical Society to increase access to vaccines with additional primary care providers by the middle of May. This isn't easy and will require everyone working out the complex storage and scheduling logistics to ensure that all doses are put to good use. And finally, we'll transition or ramp down the state's 7 mass vaccination sites. Our mass vaccination sites have played a critical role in the Commonwealth's vaccination process over a very short period of time. At mass vaccination sites, the Commonwealth has administered 1.2 million doses and fully vaccinated almost 500,000 people since the first site opened at Gillette Stadium on January 18th. These sites still have hundreds of thousands of appointments that are scheduled over the next 3 weeks to do more. The state expects to administer around 250,000 second doses in May and another 180,000 first doses over the next 7 days across all of those sites. But as we continue to disperse vaccines more widely across communities, we plan to gradually close 4 of the 7 mass vaccination sites by the end of June. But right now, appointments are still available at those 7 mass vaccination sites statewide. Folks can still pre-register or look on the vaxfinder.mass.gov site for times that work for them. We can't stress this particular point enough. Everyone over the age of 17 can sign up right now on the website to get an appointment at a location that's near them. Whether you want to go to a CVS or a Walgreens or a state-run site or a community health center, there are openings everywhere across Massachusetts. Please visit mass.gov/COVID vaccine or call 211. There's no more waiting or hassle. You don't have to get up in the middle of the night to schedule an appointment, and you can protect yourself, your family, and get back to normal by getting vaccinated soon, today, tomorrow, this week, next week. We're extremely grateful to the healthcare providers, the vendors, and the municipalities who've worked tirelessly to run smooth operations statewide to get our people vaccinated. All our sites have been built to reflect the needs of our communities and to provide a convenient place for all residents to get vaccinated. Today, we're pleased to look back on the last 5 months of the vaccination process here in Massachusetts and take a great deal of satisfaction that the people of Massachusetts have made Massachusetts a national leader in administration and worked with us to set up 900 sites where people can get vaccinated. That allowed us to hit our goal on a timeline that was consistent with the one we laid out in December. As we transition to this new phase, we're confident we'll be able to find more ways to offer vaccines to everyone who wants one through a smaller and more targeted approach. And we're very grateful to everyone who's been vaccinated or is scheduled to get their doses soon. Vaccines are safe, and they are the best way to protect yourself and your loved ones from COVID. People can get their shots from doctors, pharmacies, and at local clinics. And if you have not yet scheduled your shot, we encourage you to do so. Go to the vaxfinder.mass.gov. Sign up today. It's quick and it's easy, and there are a lot of appointments available. There's no question that the last year has been a difficult one for all of us. But the people of Massachusetts, time and time again, have stood up and done the right thing when we needed them to most to get us to the next phase of the process. We are here at this point in time because of the work of so many here in the Commonwealth. But it's critically important for everybody who wants a shot to sign up and get one. We will do all we can to make access to vaccines more readily available as we get down to what I would describe as the last 30% of the population here in the Commonwealth that hasn't signed up yet. And we look forward to getting back to normal and putting the darkness of the pandemic behind us.